Hi YouTube, this is Jack from E&T Bites, and today's bite is about the tongue. The tongue is an amazing organ that can change its shape and change its position to facilitate actions such as swallowing, speech, oral hygiene, and it can also assist in taste. The tongue is an organ comprising muscle covered by mucous membrane. In this sagittal section, you can see it comprises a body and a root. It has a dorsal surface, or dorsum, and an inferior surface underneath. This is a superior view of the tongue. It is divided into a posterior 1/3 and an anterior 2/3 by what's called the terminal sulcus over here. In the anterior 2/3, there is an apex, which is the point, and a midline groove, and it is covered by several of the lingual papillae. In the posterior third, there is the lingual tonsils, and also a small pit called the foramen cecum, which is an embryological remnant of the point of origin of the thyroid gland. There are 4 types of lingual papillae, most prominently the valates or circumvallate papillae. These line the terminal sulcus anteriorly in a V-shaped formation, and their structure is of a central mound with 2 trenches either side, the base of which are the serous glands of von Ebner. There are the foliate papillae, which are essentially mucosal folds in the lateral border of the tongue near the terminal sulcus, which in humans are not very prominent. There are filiform papillae, which are those that supply the somatic sensory afferents for the tongue, so essentially the sense of touch. And there are fungiform papillae, which are mushroom-shaped. Aside from the filiform papillae, the other 3 papillae contain taste buds and contribute to the sensations of taste. The tongue muscles may be divided into intrinsic and extrinsic muscles, and there are 4 of each. Knowing the exact functions of each is not usually important, but the main difference between the intrinsic muscles and the extrinsic muscles is that the intrinsic muscles can alter the shape of the tongue, whereas the extrinsic muscles can alter the position of the tongue. So the extrinsic muscles are the palatoglossus, styloglossus, hyoglossus, and the genioglossus. The intrinsic muscles include the superior longitudinal, the inferior longitudinal, the transverse, and the vertical muscles. All of the tongue muscles are innervated by the hypoglossal nerve, or the 12th cranial nerve, apart from palatoglossus, which is really a muscle of the palate. This is innervated by the pharyngeal plexus, which has the motor components of the vagus nerve, or nerve 10. Aside from the tongue muscles, the innervation of the anterior 2/3 of the tongue is from the lingual nerve, branch of the mandibular nerve, for somatic sensory, and for taste, the innervation is from the chorda tympani, branch of the facial nerve, via the lingual nerve. This, I should note, excludes the circumvallate papillae. The innervation of the posterior 2/3 of the tongue and the vallate papillae or circumvallate papillae is mainly by the lingual branch of the glossopharyngeal nerve, or nerve 9, for both somatic sensory and taste. However, it is believed that there are some very small branches or twigs of the internal laryngeal nerve, from nerve 10, that supply part of the posterior 2/3 of the tongue for sensory and taste, near to the epiglottis. For the lymphatic drainage of the tongue, the posterior 2/3 of the tongue drain to the superior deep cervical lymph nodes bilaterally for both sides. In the anterior 2/3 of the tongue, the middle portion drains to the inferior deep cervical lymph nodes, again bilaterally. The anterior part of the tongue and the apex drain to the submental lymph nodes, and the lateral parts of the anterior 2/3 of the tongue drain to the submandibular lymph nodes. This is easy to remember as the submental lymph nodes are, of course, near the chin. The submandibular lymph nodes are around the submandibular region. And then I guess you'll just need to remember that the rest drain to the deep cervical lymph nodes. Thank you for listening to today's ENT Bite on the tongue. If you enjoyed it, please hit subscribe to receive further anatomy videos, and hopefully see you next time.